everyone as we gather to hear Dr. Jenny Chen speak to us on the importance of good, I was going to say dental health, but I see she's calling it oral health, and I think that's more a comprehensive term. So good oral health as we age. And I also want to thank Ray and Barry for videotaping this so that those who are not able to be here today can view it later. Dr. Chen has been, maybe I'm too loud, my voice sounds very loud. Dr. Chen has been active in both clinical and academic dentistry. She received both undergraduate and graduate degrees in the University of California, the San Francisco School of Dentistry, in prosthodontics, that's a new word that I'm learning, and dental laboratory technology. Dr. Chen has been in private practice since 2004. She held a part-time position for 6 years as an implant prosthodontist at the Dental Implant Clinic and the Oral and Maxillofacial Surgery Program at Highland Hospital in Oakland. She also taught for 6 years as a clinical assistant professor at the Fixed Prosthodontics Department of Restorative Dentistry at the University of Pacific in San Francisco. Dr. Chen has given continuing education courses in China in the area of prosthodontics, dental aesthetics, and dental implants. Let us welcome Dr. Chen, who will share information about why it is so important to pay attention to our oral health.
Thank you very much. Thank you. Thank you, Sarah, and thank you for the committee for inviting me today. It's an honor. And I'd like to share my knowledge with you because I think it is important that as a patient, we own the teeth. I think everybody goes to the dentist, and when the dentist is explaining to you what you need to have done, it's good to have the education and knowledge, and that will help to make smart decisions. So my title, Understanding Oral Health, is it's a little bit broad. It's not just on teeth, but it's related to rest. It's a part of our body, so it's systematically related. So for those of you who do not know what prosthodontist is, I'll take a couple minutes to explain. It's one of the specialist dentists. We focus on repair and restoration of teeth. Okay, so mainly on teeth. So there are 9 recognized dental specialties. People know the root canal end of the endodontist. When you need a root canal, you go to oral surgeon to get our teeth extracted, and you go to general dentist to get teeth cleaning and filling. And when it's more comprehensive, then we get the people refer to us to more complex dental treatment, which is mainly dealing with teeth, filling, crowns, dentures, implants, and veneers, and anything to do with repair and restoration of teeth. So that's my special training. So I would begin with some of the dental terminology because they would be easier for communicate, and then the common dental disease that you probably everybody already know. And then some of the common dental procedures, and mainly our focus what happens to our teeth when we age, and then how to maintain it. And for self-care, that's part of the maintenance program, how important it is to maintain your teeth until the day you don't need them. So the truth of so it doesn't relate. So you see, look at the teeth are by numbers, and it's the teeth charts here. This is where I wish I would later put. I thought they would go in here. If you look at the one on the charts, it's the number. It's like every tooth is like a social security number. When you say the number, you know exactly which tooth it is, which is universal to everybody. So we go by the numbers. there's 16 teeth on the upper and 16 teeth on the lower. So when we say 1 or 2 or 3, so it's on the upper teeth. And when we say 17, 18, 19, or 32, it's in the lower. And on the middle, it shows the tooth has the white portion on top, which is the enamel. And below the enamel is the yellow portion, that's the dentine. And then the red portion in the middle is the nerve. Let me see. And then, of course, the roots. And the tissue around the roots is the bone. Above the bone is the gum. So when we see whatever that you see as a white, am I blocking you? When you see the teeth that you see when people open the mouth, it's actually only see the portion above the gum, so that's the teeth. But underneath is the structure that's holding by the bone. And well, in advancing age, is the bone gets as lower and lower, the teeth become longer and longer, and you lose less and less bone, more and more bone, so the teeth become, the teeth embedding bone that gets less and less bone support, so you end up the teeth become loose, and that's one of the big major reason for people losing their teeth is due to gum disease. And on the picture on the other side is the X-ray that shows that correspond to the tooth. And that screw that you see there is actually a picture of an implant, and which we'll talk about it towards the end of the lecture also. So the disease that we pretty much, it's very common, we already know, is the decay. It's in us with things happen to teeth, or decay, wear, and fracture. So a cavity is, and a lot of people have that, and we do a filling. And wear is when we wear and tear. So when we get older and older, the top part of the enamel got wear off, and then that's when you have sensitivity or some other problems that I will focus on later. And it wear or decay or fracture to the point that expose the middle portion of it. It's the nerve exposure, and that hurts like hell. People, that's when you have emergency, go to a dentist, and then the tooth hurts so bad that you need to have a root canal. And some of the patients even tell me they'd rather giving birth than having a root canal. It's that bad. And so we try to get to the preventive procedures where we do not have to get to need a root canal. And periodontal disease is what happens around the gums and the bone. Receding gums that happens on some people, premature receding gums, and some people, otherwise it's also very common when we get older and older. And so the pink portion on top, it will get lower and lower, which I will have pictures to show later, and then become the root exposed. So the root is very sensitive, and then root surface is also very easy to get decay, so it's called the root caries. So those are very common with when we get older. And then to the point where many times the teeth happen so much that we can't save the teeth, then we have to take out the teeth, and lots of people have some teeth missing. I have a small practice, but let me see, I think I have maybe about 4 people in total that I can think about right now. They're in the 90s and have every single tooth in their mouth. That's very rare. Okay, and I have a picture of my favorite patient. She's not favorite, I mean, she was, I had her for a long time, and she was 103, and I think I saw Taylor still. I have her picture here, and she had every single tooth in her mouth also. So that's what we like to do, is to be able to maintain it. So here the diagram shows the progression of decay, where we can see the second tooth. You can see a little black hole. That's a little starting small, and then if we don't treat it, it will get bigger and bigger. Decay is like termites. So when I tell people, say, oh, you have a cavity, you have decay, we need to do a filling, people just don't really respond to it. I said, well, it's like termite. I said, oh, can I come in tomorrow? So people don't really grab the concept where we think, as a dentist, it's like we talk about it all the time, so we think, oh, it's very easy to understand, but unless you relate to something that people can relate to, it's hard, they don't, most people, unless they know the importance of it, they tend to kind of push it off, especially when it doesn't hurt. So in the beginning, it doesn't hurt, and when it gets bigger and bigger, it will get to the nerve. On the picture on the right, on the other side, you can see the little pointing there says the abscess. It's the bacteria goes into the nerve and goes down to basically to the end of the tooth, and then spread into the bone, and then you have an abscess. Okay, and lots of people have abscess, and that sometimes it comes and goes. And I have even medical doctors that they don't even understand the importance of it, because in their thinking it's actually just an abscess and it goes away, it doesn't hurt. But I personally have indirect friend that was supposed to come in and they didn't come in for whatever reason, actually died from a dental infection. I have a friend who is a medical doctor who got an infection so bad that ended up she was coming to my office and she was describing how bad the situation is. I said, turn back and go into the emergency room. And she ended up into UCSF and was in the hospital for 2 days, training of the infection. So in many times, it's no big deal. It's just a pimple that you see on and off, and it doesn't hurt. But when the bad case, it can be life-threatening. So in other words, it's like, the importance of preventing all this from happening, right? So the procedures that we normally perform are, as simple as teeth cleaning. So teeth cleaning, I'm going to focus on this slide over here. In the lower portion of it, it looks on the side of the teeth, looks pretty clean. And then you can see the brown and the spots getting onto the teeth. And that starts causing the inflammation on the gums. So you can see the gums, the pink portion kind of slowly pulling away from the teeth. And then when it doesn't get cleaned out, it gets deeper and deeper into the gum and the bone. And so you're losing more and more bone. If you compare the three pictures, the pinpoint down is between the teeth. That's actually the bone level. And when it has inflammation, it will shrink. And it shrink back to the picture on top there. You see that's very high up there. So your teeth are getting less and less support from the bone. And when it gets to some point, enough bone loss, the teeth will become loose because it's nothing to grip to it. And then actually there are people come to, I don't know why my friend all of a sudden the tooth just fell out of the mouth, which is very severe, but to the point because there's nothing grip to it. And I know those people probably just afraid of dentists. Things happen in their mouth, they're just afraid to go. And it just kind of gets worse and worse. And that's usually the case. It's when the teeth fell out of the mouth and for no reason, it's because there's no bone support. So we do teeth cleaning, and filling is simple, just when there's a cavity, we do the filling. And a gum surgery is it will be a periodontist is another specialist in focus on doing gum surgeries, and there are many things that can be done, including grafting and grafting bone, and there are lots of fancy things that can be done. When it's necessary, when we see the first line, what can be preventive, then we do the preventive procedures. When it needs reconstruction surgeries, we're sent to periodontists. And so then when the teeth gets more destructive, then we can do crowns and bridges and dentures, and I have samples to show that. So this is the material that we talk about. There were silver filling, I think, in the older time that lots of people had the filling. They were done with the one on the right-hand side. That's the dark color filling, and that's a silver filling. And lots of people have those. Now the material is pretty much banned in Europe, And so do the choose color filling one. America still has the silver filling, but I think less and less be able to find a dentist who actually still do this amalgam. I actually still have it because occasionally the situation call for it, but lots of offices don't even have the facility to do the silver filling anymore because Europe is already banned, and just thinking America will, will be best. So choose color filling, and then when we do the crowns, there's porcelain crowns, there are gold crowns, and the newer material, zirconia. You probably don't have to know all this, but when you ask for a question, when you need a crown, we'll ask, do you want porcelain or you want gold? So, and that's a different material choice. So these are samples of the crowns to see if we can make a tooth look really real. So there's a single crown on the left side, that's dentures, a full denture, and a partial denture is partial, so it covers not the whole mouth, and then it's a bridge. So when you say a bridge, it's something that's glued onto the mouth and you can't take it out. And when you say denture, usually it's removable, so something take it on and off. Although nowadays we do implant screw-in dentures, which I have pictures to show. And then I can talk about the advantage and disadvantage of it. But usually, before implants are available, when you mix a lot of teeth and there are no teeth to anchor for the bridge, those are the pink one, the partial denture and the full denture are the ones that lots of people have. And now implants are pretty much accepted practice, so lots of people start doing implants. And it's not just the beginning, even in my career, I have done more than 10, 15 years of study doing implants, and in the cases that were done well, they do a good job. So the bridge is the ones like on the lower corner here. It's glued on, so it's fixed in the mouth, and you can't even tell. And the other one, you can even with the implant, you screw it on, and I have pictures that you can see. So this is a lady mixing 6 front teeth. So that's the bridge on the corner. So when you just screw it on, it looks really good. You can't even tell that's a bridge, and it functions like your own teeth. And so that's when people are able to do that. It's usually what the first thing people want to have. But it costs more. The dentures, the partials and the dentures, the least expensive way to replace teeth. So nothing else, we can always do that. And that gives the function and the integrity of the smile. But if we're able to do more, then we do the next level, which is the bridge of the implants. So this is a sample of the bridge, and then this is sample of the filling. So mixing a corner. These are very simply done, and you don't have to go around with a missing tooth. A missing portion of the tooth is very simple. And we can use the same tooth color material to mold the teeth that would look like, so this young guy, he didn't like the space. And so we can easily do that to make it look beautiful. And he didn't want to have braces because the braces would take several years and it would cost a lot more. And you do a lot of this because they didn't want to go for braces. They probably got ready for a wedding. They don't have time. And so this is very simple. And the beauty of it is it doesn't remove any of your tooth structure. Okay, so this is, again, I'm doing this, showing the samples of the procedures that we could do. This is tooth color filling. So again, it's been a while now that people worry about the mercury in the silver filling. So they come in and they want to replace, and they also want to look beautiful. So you replace the silver filling with the tooth color filling. You can see that the before and after there. So you usually get a recall card. It says the time for you to do the exam and the cleaning. Okay, so we talk about the importance of cleaning. And the exam, what do we look for? The exam we look for is we do the cancer screening to make sure there's no things that grow in the mouth that we might need to send for biopsy. Okay, it's a higher increasing risk as we age. So that's one thing we look for. And you see there's a little thing on the tongue. So, oh, is there something that we need to worry about? And then you see the dark spots and those cavities. So we replace the filling. And then another thing we see is, I don't really see that 1, 2, 3, next to the big tooth, the tooth has a crack. I actually have pictures to show. There's a crack and a wear, so we look at that to what we can do to prevent it from getting further developed. It's everything, there's a progression, and with recognizing how we can intervene so it doesn't develop into further destruction. So, so what happens as we age? First, I see a lot, and it doesn't happen to everybody. That the main thing is the teeth wear. You can see the picture, see the teeth, and I have lots of patients coming. It's driven by their spouse. Okay, so when I married you, your teeth were long, and now your teeth are only like a half as long. So they want to do something, and that is why. And usually the person who has teeth wear, they don't even know because it doesn't hurt. And especially when they're older, you can't really see. You don't really look at yourself with a smile in the mirror. So they usually don't know. It's the spouse that usually tell the other person party that, oh, you need to have something done. The other thing is the gum disease. I think I kind of touched that on. Is the gums shrinks. So that portion of the tooth, which is called the root. Root exposure, that portion is exposed, so it's very easy to have build up, like the calculus build up again, because it's a rougher surface. It's also very easy to get decay. So those are the two main things. Cracking is like everything else. It's wear and tear, so there are lots of teeth crack. It used to be not a big deal, but now it becomes, more potentially fracture in the teeth. So we need to do something about it. So I think I touched on the teeth wear, teeth crack, fracture, root exposure, and then missing teeth, gum disease, which is we talk about receding gums. Another main problem is the xerostonia, which is dry mouth. So lots of people, because of medication, it reduces the salivary flow, and saliva is very, very important to keep lubricate the mouth and the teeth, and then also has antibacteria. So when people have dry mouth, that increases the risk for all the diseases we talk about. Okay, so that's another thing. That's don't really have a good solution, but lots of my elder patients have that because of medication and just natural development. So here's the picture that I can show. Lots of people have fillings in their mouth from the old time. And you can see, I'm not sure if you can see that tooth, and the first tooth has the filling, has a crack. Okay, so that's what I see. And so we have to address that. And then another filling on the big tooth in the middle has a crack, and then on the side there's what we call the leakage. So bacteria goes in and gets decay underneath the filling. So we need to take care of that, otherwise it will continue to disrupt the tooth, and then gets to the nerve, and then gets to the root, the abscess that we talked about earlier. And then that little tooth that you saw, there's a fracture line going already across. So when it gets deeper, it will split the tooth, and then all of a sudden we have to take out the tooth, and the tooth was mainly, it was one of the crack that was never taken care of. So those are as the increasing age, those are the risk factors that we have. So as a dentist, we'll look for all these early signs of it, and if there's something we can do to stop the process. So here's a picture shows we call the calculus. I don't know if it grows someone out. You can close your eyes. So the yellow portion from the teeth is clean. So it cleans it out, so it doesn't give it. So see how it corresponds to the other picture. The calculus pushes the gum down. okay? And then it caused the inflammation on the gum, and then so you lose that portion of the gum and the bone, and the tooth gets longer now on there, and you can see the roots exposed, and that portion is very easy to get decay. So when I do the teeth cleaning, do the exam, it takes me a long time to do the exam because I actually use that what we call the explorer. It's just the size of a needle. I go around, 32 teeth, go around every single spot just to make sure there's no soft spot, which is caused by cavity decay. So I go around all the surfaces with the needle, basically, to check to make sure there's no early sign of decay. Because we want to take care of it when it's still small. And this is a picture shows the signs of wear. If the teeth wear this is very common, and some dentists don't even recognize it. Because usually we were trained a long time ago was just to recognize cavities, and because there's lots of cavities around. And now people live longer and longer, so all these teeth all of a sudden becomes a problem because of the wear. And to take care of it, usually it's very difficult for one thing, and it's very expensive. So we want to recognize the progression and then see if we can stop it at earlier stage. So it shows the picture of teeth can wear from top down and teeth from wear came from the side. And that picture of you can see some are smaller, just going in, and the middle one is digging in really deep. And when it's deep enough, the tooth can actually fracture. So I have pictures there, more pictures to show. So to do this is, again, it's very easy. All we need to do is put that tooth color filling, patches it, and that look at the before and after. So it stops the further progression of the wear. Same thing, so when we do the exam, we check for little wear, so that one's smaller, but we easily stop it before it gets too deep. And look at I have another picture. Look at the tooth that gets it wear from the side, from the front, from the side on the front, the left and the right. So the tooth gets really narrow, and look at it's very easy. You bite on something, hard candy or something, all of a sudden the tooth fracture. And then just the root is exposed. And now people coming in, it's like a fracture that actually had a patient was right before Thanksgiving dinner, people coming in for dinner, and all of a sudden I'm missing his tooth because it broke last night. So, and to do that, we have no way to put a crown on because there's nothing to grip to. So now we're talking about taking out the tooth, doing implants, as it gets expensive. So to do this is very simple, to just recognize it early and keep it, stop the process so we can keep the teeth there for a long time. And here you can see another example. Look at that's very much the teeth that have wear down to the bottom. You can compare the both sides. Again, to do this, at this point, we'll need to do a crown. So a crown needs something to grip to. Again, there's nothing to grip to because it's already down flat. So what we'd like to do again is prevention. And sometimes you can, no matter what we do, it still continue, but it's at least slow down the process. Okay, so here's the gentleman who came in with, look, the teeth wear. This is the wife said that, it was much longer teeth when I married you. Now it's only half size. And that, look at I don't know if you can see as well as I see, is the teeth are just very small, just a little stump. And then from the back side as well. And so what we did was we had to end up doing crowns. And crowns are expensive. So now you're doing multiple crowns. It's not just one, okay? But this is one, and most of people didn't have time. And so usually it's come when they're ready to retire, and now they're going to lose their insurance, and they have time now, they want to do something, and that's exactly what happened with him. And the other picture was a 12-year follow-up. So usually when it's done and done good, it can last for a long time. And that's how he looked. And this is another lady who's look at her pictures when she was in the 20s, noticed her own teeth were getting shorter. And then also over the course of years, she had some crowns that are a different color, and she wanted to see what can be done. And that was what we did, was we ended up have to get crowns or veneers and then change the old crowns to make them all look good. And so she, so that's how she looked, and she was very happy with what she got. And this is another lady who, same thing. So we ended up having to do all the crowns because of the wear, and was left in the true structure, so we can do just crowns. We didn't have to remove the teeth. Okay, so I think there's only one tooth that have implant, but it's crowns, and again, she's extremely happy. Kept sending me pictures. When she goes to reunion, she has the best teeth. That's what she told me. So again, this is patients coming in their 40s and 50s, and they say, well, I noticed my teeth are getting shorter. I want to do something so when I'm 70 and 80, my teeth don't get too short. And so we start doing something. This guy was, so we start doing something, a little filling here and there to prevent the teeth from getting that level, which is a severe wear. And sometimes the teeth crack so bad that there's no way to save it, because the teeth are actually into 3 or 4 different pieces embedded in bone. So in this case, we have to take out a tooth. So what happened when you lose a tooth, what are the ways we can do to replace teeth? There's 3 ways we can do. One is a fixed bridge. I think I kind of touched that on there earlier. And then there's a dental implant. And then there's a partial denture and full denture. So partial and full denture are the old ones before dental implants are available. So lots of people, when they have missing teeth, then most of them have partials before or the bridge. And so again, a fixed bridge, let me see. So fixed bridge is like this, is that you have multiple teeth, usually 3 teeth, connected together. In this case, it's 6 teeth connected together, and then glue up or screw with implants onto the mouth as a bridge. That's a much longer bridge. So again, mainly it's just multiple teeth connect together, and so it's called a bridge. And so this lady has crowns and bridges or whatever done before, and then got decay underneath, so we have to replace it. So so when we do that, it's easier to get better result when we do that all at the same time. So if financially, health-wise possible to do it at the same time, that's probably the best way to do, because we can match the color. Look at, she's like 80-something years old, and she had lived like that mouth for a long time. But she's so happy when they got it done. And she, again, keeps sending pictures. She's like, I keep smiling everywhere I go. So this bridge can look really good, and just like your own mouth, it's very natural looking, natural feeling also. Where a partial is like this, okay? So you have teeth that are removable, and it's connected with a wire of some metal to give strength. And so this the old technology. It still holds water for lots of people, so we do a lot of partials for reasons that when we cannot go into bridge or implants, and that's why we go into partials. But again, it's connected by metal, and most people don't like it for 2 reasons. One, they don't want to feel old because that's what they remember their grandparents used to have, right? So this is hard for someone in the 30s and 40s to have. and then it's something extra in the mouth. So you have to take time to get used to it because it's, oh, I can't talk very well now because it's something there. But eventually people do get used to. So, but anyway, so that's a removable partial. Again, it's the least expensive. So when people find that missing teeth, like in this case, and missing all the back teeth, so there's nothing to eat, right? So we have to give some teeth. And so if someone's not healthy enough to go through the implants, and someone is financially not able to afford the implants, it's a lot more money, then we do this. Okay, and that can look really good, and most people do get used to it, and they're happy. So here, like this gentleman did the partial to the front, and this is what he smiled, and he's so happy. When I put it in, he looked in the mirror, he ran out the door. He said, "Now I can go kiss a lady." He's like, "I didn't know how I can look so good." So because people have their minds like, well, partials don't look good. But they can be good. But you see, again, it's the extra piece in the mouth and covers the palate, so you do need time to get used to. So when we make the design, we did, have considered all these factors. And this is another lady where we were able four front teeth, so it's another partial, and the wires are in the way in the back. Because when she smiles, she shows all the teeth. So we try to design put the metal oil in the back. And this is another partial. And so when the patient smiles, just show a little bit of the wire. So lots of consideration when we make the partials, and we try to make it as good as we can. And here's a lady in dentures. So dentures can look really good also. The main thing is it covers the palate, and we're out, so people who do have dentures, I don't know if in the audience if people have it, so that's the main thing, is that covers up the palate, so it reduces your ability to taste food. So if you're able to do that with the implant denture, where you don't have to have the palate, and all of a sudden, I have patients come in, all of a sudden life is so good, now I want to go out to eat. But it can, when it's well made, it can look good, and it can hold up really well. So that's the lady, and you see, she feels so sexy. She comes in and she's so happy, put her hair and all that, and she starts dating a younger guy. We'll go talk about use of dental implants, and I know you have some lectures on dental implants, so I'll just have a few slides. Mainly your implant is a titanium screw that goes into the bone, and then we make the teeth that matches the rest of the teeth, and then we use a screw that screw into the implants, so you can see it doesn't have to touch the adjacent teeth. So that's the beauty of it when there's someone who's younger, and the adjacent teeth are good, then we try to de-implant so we do not have to touch the adjacent teeth, and that's the beauty. So mainly I can see a lot of benefit for the implants, mainly what we're talking about. Look at the denture that covers the entire palate, right? So covers up, so you lose the taste bud. You do get used to it, and when there's no other choice, that's the only way we have teeth. And like that lady, she had it, and she's so happy because it gives her the smile, the confidence. But in terms of if possible, go into this way, which is called the screw in. It's still a denture, but it's screwed in, so you can see. So the palate's cut off, and we use the screw into titanium, so it's secure, so it doesn't come off. So the difference between this and also is that it doesn't come off, so you have to know how to take care of it, because when people use denture, they like it, they can just take it out and then rinse it and brush it and then put it back in. This one, you can't take it out. So only the dentist can take it out. So we can take it out, we clean it, but there's several months in between. The person has to be able to clean it. So I have a lady that I finished last year, maybe even 2 years ago, And she hurt her arm, so she doesn't, it's difficult for her to clean. And then I asked the caretaker, I said, well, can you help to brush? And they don't want to do that. So I have her coming every once a month to clean because it's difficult for her to hold a hand and she doesn't want to learn. And so the only alternative is to have her come in. And I talked to the caretaker, I said, well, we need to train the people how to take care of it because over time will get infected. So if you don't clean well. So this is the difference. If you are able to, the maintenance is important. But in terms of quality of life, this is so much better because what we're talking about, it doesn't cover up the palate. So this is the main advantage of the implant denture. Also, it's secure. And so we can do that, and that's a very common. Minimally, we do 2 implants on the lower when people have dentures. The lower denture, the upper denture, I never had problems. It's always secure. The lower, because of reduced amount of bone support, and usually have, no matter how technically good, it will have some kind of movement. It's the movement that causes the pain. So lots of people struggle with the lower denture. So I got a lot of referrals. So technically we can make as good as possible, but it will never be as good as if we're at least putting 2 implants. So this I see the main advantage. So the cost is based on how many implants you place. So and the other one with more implants, it's more expensive. So this is what I think is the bare minimum, to put 2 implants and then have the denture that will have something to grip to. Okay, so, and this also, patient can take it out and clean. So I think this is probably a happy medium, where I see a lot of patients, and when they are able to, that's what we'll do, and then instead of going the more expensive, which is more expensive better, but this is at least good. And the implant can be for 1 tooth. So this is again, the adjacent teeth are good, and it's a bicycle accident. We lost the tooth, so and she's very young, so put the implant for just 1 tooth. And this is what, she's very young, and this is how she looked after I put the implant. So it looks good, and without have to touch the adjacent teeth. When we do multiple teeth, this is also very common. Lots of people missing teeth in the molar. And so we do the 2 teeth and screw it in. And the beauty of this is that we can unscrew. You can see the screw head in there. If something happens, we can unscrew, clean it, and put it back. And we cover the hole with the tooth color filling, so you barely can tell there is a filling in there. So on the other side, you can't really tell at all. This is the, to show you that you have the screw in there. So the beauty of that is you can actually take it on and off. And then if we need to, we can take, we don't have to destroy the crowns. And we can do that in full mouth, as we talked about earlier, or we can do 3/4 of the mouth, like this gentleman had 4 teeth. So we keep the 4 teeth and do all the other quarter of the mouth with, again, there's a screw quarter denture, I guess. So there are different designs, and this will go all the way. This is probably the most expensive. It's everything, and it's a big bridge, and it's done by porcelain rather than the denture material. And so this is the most expensive. We don't have to go to this category, and I think that the screw-in denture and at least the 2 implant denture is probably the happy medium because of the time and the cost and the functionality of it. That's probably just a happy medium. And again, this is that big bridge that's screw-in, and here's the denture on the lower. It's called the screw-in denture. This is just a screw-in, so you don't have all this extra flange. And we can do the implants on the partial as well to help to hold it. And so it's more secure than if you didn't have implants. So there are lots of designs, so every situation is different. So when I'm presenting with a case, that's where I think it's important that people have the knowledge and education, so it's very easy to communicate and know what we can do and then to work together to make the right decision for the right person and then be able to maintain it together. So just like everything else, it's not everything is created equal. There are some people are not doing the same denture can be different qualities. So this is the same lady have dentures. This is the one we rearrange the teeth. That's an old denture, and that's the one that. So just by arranging the teeth differently, if you look at, I don't know if you can tell, the profile is so different. Okay, so and that's not even bad, right? So just to show that with the different arrangement of the teeth, the facial profile can look different. She just looks so much more dignified. And the dentures, so some are made, like this is a roller coaster. We call it a roller coaster, ups and down, when it's supposed to be more even. When you look at the smile. This is again the old denture. This is one where we do the denture, the new one. So it's a lot more even, and that one really smiles like a roller coaster, which it affects the function as well. So when it's not even, when you bite, the denture moves. So that's when we arrange the teeth. That's how we control the movement of the denture, so it doesn't move when it's normal eating, so it doesn't hurt, because when it moves, it hurts. So that has to do with the bite. So that's one example. This one. The same one. This is the crowns. So those are crowns and these are crowns. So they're different, just like everything else. Not everything is created equal. So you want to, if you have the eyes and you have the demand for it, you want someone to do it so it looks good. And this is again that lady. So with no teeth, and she just looks so much younger with the teeth. So. Okay. And this is the choose color, same thing as choose color filling. This is also choose color filling, and that's also choose color filling. Where by choosing the right color, it doesn't show. Okay, so there are different levels of the skill set in there. And this is another implant denture, implant crown. So when it's not designed properly, when you smile, it shows that's a crown in there, and that doesn't look right. But the other one, you can't even tell there is a crown and an implant in there. So all this, takes that design and attention to details. So how do we maintain a good oral health? Mainly brushing. So my friend's daughter do the brushing here. So you have to, either it's your teeth, your denture implants, it's a self-care is so important. So brushing and flossing, the dental bridge, I mentioned it earlier, the dental bridge is in the mouth and the implants are screwed in the mouth. So you have to remove it. I think this slide shows it. Okay, so you have to get into, this is the denture that's screwed in, so you have to get it underneath and totally clean out the debris. That is irritants to the gums. It can get infected, it can swell up, and then it makes it harder to clean. So you have to, when you have something like that that's screwed in, it's so important, and then if you can get a piece of plastic, I kind of scrape it. I was trying to teach the caretaker for the patients, where some of them just have problems self-cleaning. Then I try to teach the caretakers to be able to at least do that, brushing, and then if you can scrape it, or even at minimum, like using a soft cloth or Q-tip, okay, just kind of clean that. And then you can get in between. If you can do the floss, it will be super floss, will be really good to clean up. And if not, then get if you can, even get something in the middle is the water pick. This is a picture from Macy's, a great deal today. So it's a water pick that comes out with power pressure with the water, and then it's injected. So I have one myself, and I don't have implant crowns or anything, but it goes in between the teeth, where the teeth are, when you lose, the gums gets longer. When there's spaces in between teeth, the food gets stuck. So the food, it will irritate, the food debris and the bacteria build up, and like the calculus, the calcium deposits on the teeth. So it builds up over time. So we clean it, every 6 months or even 3 months. But every single day, when they clean it out, floss, and then use this one to like a power wash it, so like a power wash the car. And for people who have dentures, when you come in, over time the gums will shrink more, so it start rocking. So we do something called a reline. So when you come in, even have dentures, we check to see if they need a reline. So we do the reline, and making sure the teeth, polish and all good, so it doesn't have bacteria on the denture. And most people probably, if you have dentures, they're soaking in the water overnight to have the denture cleansing, to keep the denture clean and fresh. Otherwise, it has an odor and it doesn't smell good. So this is my patient who lived to 103, and that picture was taken when she was 100 years old. It was her birthday, and that's the first thing she wanted to do. She had a hip replacement surgery and was unable to go outside for a while. The first thing she wanted to do was to get her teeth clean, and that was on her 100th birthday. So anyway, so it's important to self-clean and also professionally clean, because there are areas you were not able to get to. And I think that's all I have for this. And mainly the take-home message is I guess keep it clean, and if there are any problems, you go, make sure follow up with the recommendations of the dentist, because any of these little things can potentially grow to bigger, and when it's bigger, it costs more time to take care of it, costs more money, and it just becomes a bigger problem. So you want to take care of it when it's a small. So that's any questions? I'm happy to, yes.
What's been your
Thank you. What's been your experience with Fosamax, those kind of drugs,
Yes.
and your recommendation, or what you've seen, your experience of that?
Yes, so there were probably, I don't know how many years ago they came out, so it affected, the bones won't heal. So there were people who wouldn't take out the teeth, because after taking the tooth extracted, the bones won't heal. And I think, and then won't do implants. So I did have a patient went through it, and I work with the oral surgeon, and she recommended was stop the Fosamax for 3 months and switch to something else. And there's obviously will work with the MD. So you still want to get your calcium supplements, because that's not something we'll know how to take care of, but not with the Fosamax. And after 3 months, and they were able to check the bone density and then be able to put the implants in. But mainly we try to avoid it. So we avoid, if we can avoid it, we avoid extraction, avoid implants. So if that's the case and you still have your tooth and you have a crack on the tooth, I'll try my best to save the tooth and do the crown, so we don't have to take out the tooth and go through the implant. I hope that answered. Okay, yes.
I'm just curious. I'm not planning on having implants, but approximately what is the cost of one tooth being implanted? I mean, is it $1,000, $10,000 per tooth?
Somewhere in between.
Oh, somewhere in between. Okay.
Yeah.
It is expensive.
Yeah, it is expensive. You see a lot of advertising for lower cost, and so when it comes to this is like, obviously pick a good doctor that you know, or sometimes it's hard to know actually, someone that knows how to do it right. Because even if you pay less and you have to pay to redo it, it will cost more, right? So it's always picking the right doctor that have the right skills. But and you're advertising for a lot less, which I don't really know, but the ongoing price in San Francisco is somewhere probably around 5,000 or 6,000, and it depends on what needs to be done also. There's bone grafting, it'll cost more, and yeah, there are lots of other things. Depends on the location, like the front, like the two teeth, one didn't look good and one looks really good, that one requires a lot more work. And it's important for her to, doesn't show, so the other one probably didn't care, and so as long as they get the implant. So there are lots of more procedures we have to do, more costly it is. So but it's in between.
Well, I had a question. How important, or what effect on the teeth does the diet have, in your opinion?
Well, yes, the carbohydrates are not good for the teeth. So the fibers are good. So like the salads, something have fiber that would while you're chewing, it self-cleans the teeth. Acids are not good, but I don't really have a good solution for it because acid can potentially eat away the enamel, and that's where I see a lot of wear. There's some of my pictures, I see the teeth are really low, and then the back teeth are like almost flat. Acid contributes to that. So there are lots of, and so when you have acid, but then to the health of your general health, you want to have salad, you want to have vinegar in the salad dressing. So, and then lemon, I guess there's a lot of good health reasons, but not good for teeth. So, yeah, so if you do eat it, I think you just avoid brushing right away, because if the teeth are still soft, and then maybe, or some was recommending gargle with warm salt water after you eat any kind of acidic food. And lots of these are still kind of, lots of suggestions, but I don't know if that really prevented from having anything.
Any comments about mouthwashes?
There's journals, an article, I think said that it's actually not good. Yeah, so there are lots of controversials. To me, I usually don't really recommend anything unless people really want to use it. Okay, so my recommendation usually is just warm salt water to gargle. Brushing, it's mainly mechanical brushing, removal, just like cleaning your kitchen or something, just mainly mechanical brush cleaning. So if the chemical removal is in mouthwash, some kind of chemicals try to dissolve the calcium and then make it easier for you to clean. So if someone really wants to use it, I don't discourage it. But if someone asks me, I personally don't use it, so I just tell people not just use. But there is, so they will tell you actually it's good to have it in a lot of dental journals. But there was one article in the English journal, what is it?
New England Journal?
Yeah, exactly. It says that that's not good because it disturbs the bacteria balance in the mouth. So I don't know what to believe actually.
I've even seen recent commentary about not flossing your teeth. But I couldn't believe that you should not floss your teeth.
Oh yeah, the guy said that there's no scientific benefit, proven benefit of flossing. And I like one guy calling and said, well, there's no scientific proving that you should shower either, so why do you still shower? So I like what his comment. But it just makes sense that, you remove all these irritants out of the mouth.
And for a dry mouth, do you recommend artificial saliva?
Yeah, when you get to severe, there's really not good solution. But basically, for people who have a dry mouth, just drink water or the saliva, artificial saliva substitute, something ice, something just to stimulate, or chewing gum, that there's something that a biotin that they sell that chew gum that doesn't stick to the dentures, and so if you have that, it's basically just constantly keeping your teeth, mouth moist. And even not drinking, you gargle and spit it out, and just keeping it moist to that level.
Any other questions?
Yes.
Floss after brushing or
I
vice
can hear
versa?
it. It probably doesn't matter.
Oh, okay.
Yeah, probably doesn't
What
matter.
was the question?
Floss before brushing or brushing before floss? Yeah. So I usually brush it first and then floss, and then I use the water pick. And that one's really good. It's messy, but it's really, really good.
All right.
Thank you so much.
Oh, thank you. I hope that answers some questions. Thank you.